We often talk about heartbreak as a metaphor, a poetic way to describe the crushing weight of loss. When we lose someone irreplaceable, the emotional pain feels heavy, almost physical. But could this profound sorrow actually pose a threat to our physical survival? Can an emotional wound become a fatal one? Science suggests the connection between a broken heart and mortality is startlingly real. Decades of public health data highlight a phenomenon known as the bereavement multiplier, or the widowhood effect. Statistics reveal that when a long term partner passes away, the surviving spouse faces a dramatically higher risk of mortality, sometimes spiking by nearly 90% in the immediate weeks and months following the loss. It is a reality that frequently causes couples who spent lifetimes together to depart within days of each other. Part of this is a slow, systemic decline. Deep grief frequently triggers severe depression, which elevates inflammatory markers in the bloodstream, quietly weakening the body's defenses. Furthermore, the sheer exhaustion of mourning, combined with the absence of a caregiver, can lead people to neglect vital habits, forgetting meals, skipping medication, and losing sleep. Chronic stress subtly rewires our system, altering digestion and destabilizing hormone regulation. But beyond this gradual wear and tear, there is a sudden, acute medical emergency where intense feelings directly jeopardize life. In the early 1990s, medical researchers identified a unique condition called stress induced cardiomyopathy. It is famously referred to as broken heart syndrome, or Takotsubo Cardiomyopathy, named after a traditional Japanese octopus trap because of the distinct shape the heart assumes. During an episode, the left ventricle, the heart's primary pumping chamber, suddenly weakens, pooling with blood and ballooning outward. While the vast majority recover, about 5% of cases can trigger critical, life threatening cardiac events. Interestingly, this isn't just caused by tragedy. It can be sparked by any overwhelming shock, including extreme joy. The culprit is an unprecedented chemical surge. When an emotion is overwhelmingly intense, the brain floods the body with massive amounts of stress hormones like adrenaline and norepinephrine. The left ventricle is packed with receptors sensitive to these chemicals. Flooded by this hormonal tidal wave, the heart muscle becomes temporarily paralyzed or exhausted. Simultaneously, these hormones can cause temporary spasms in the surrounding arteries, choking off the very oxygen the heart needs to survive. The result mimics a classic heart attack, presenting with severe chest pain and breathlessness, even though the coronary arteries remain completely unblocked. Because the symptoms are identical, it is notoriously difficult to diagnose instantly. In the emergency room, doctors treat it similarly to a heart attack, utilizing beta blockers to shield the heart from adrenaline and blood thinners to protect the cardiovascular system while the body stabilizes. While anyone can experience this, data shows that postmenopausal individuals are statistically the most vulnerable, likely due to shifting hormone levels. Ultimately, broken heart syndrome serves as a profound reminder of just how deeply our minds and bodies are intertwined. Yet, there is comfort in the data. Just as the human spirit can endure profound sorrow, the physical heart is remarkably adaptable. In time, with care, patience, and support, even a broken heart can find its rhythm again.